Hello, my friend. This is Dr. Jeffrey Beto of The Buzz with Dr. B. This is the companion video for rheumatoid arthritis treatment that was recently placed on myspineandjointpain.com. There are many details in that post that I'm not going to go over in this video, but I want to emphasize a few things, and so I've made this video to do so. First of all, I want to remind you that rheumatoid arthritis is a disease that is called an autoimmune disease. What that means is that the body fails to recognize self as self, and certain key target areas of the body are then inflamed or damaged by your own immune system. Now, normally, your immune system is what keeps you healthy as regards invaders. Bacteria, fungi, viruses all live in and on your body. And were it not for your immune system, you would self-infect quite easily. The immune system keeps those things in track. But when the immune system malfunctions, if it overfunctions or underfunctions, disease can occur. In the case of rheumatoid arthritis, it overfunctions. And your immune system is then directed against certain areas of your body. In the case of rheumatoid arthritis, it's the synovial membrane that lines certain joints of your body. Now, rheumatoid arthritis is still diagnosed clinically, which means you have to have a good history and physical, usually done by a licensed medical practitioner. There are some very elegant tests that we can perform to confirm a clinical diagnosis of rheumatoid arthritis, but still the diagnosis is made the old way, with a good history and physical. Fortunately, the treatment today of rheumatoid arthritis is much better than it was when I was in medical school in the 70s. The number one improvement in treatment for rheumatoid arthritis has been a class of medications called DMARDs. Those are medications that actually modify the immune function in a person with rheumatoid arthritis. And by doing so, it can reduce the overall joint inflammation and resulting damage. This is so important. These medications are often started early in the course of rheumatoid arthritis so that the amount of joint damage that occurs is quite minimal. Years ago, our therapies only were to treat the symptoms and the swelling, and they didn't modify the overall joint destruction. That's different today. I want to tell you that the prognosis for rheumatoid arthritis is much better today, and if you or a loved one are suffering with it, there is hope. By seeing a primary care practitioner, establishing a diagnosis, and then referral to a specialist in rheumatic diseases called a rheumatologist, most people with rheumatoid arthritis are going to have a very good result.